Hello there. Today's treatment is for urinary infections or cystitis, anything like that. Um, Here are the areas we're going to focus on. Got the pelvic area around here, the uterus, the bladder, the adrenals, the urethra, and all the spinal nerves relating to those areas. As you can see, it's a pretty straightforward treatment in that all the points we need to work are pretty much in the same area, and actually as a result of this it's an easy treatment to do on yourself. It's all on the instep, and I'll show you that in another video. Anyway, here we go. Just need a little bit of Vaseline. This is what I use. Any lubricant will do, but I find Vaseline to be very ideal, to be honest. It doesn't get absorbed easily, and it gives a really good consistent level of slide, and that's what my techniques involve. So we start with a little warm up of the foot, stretching it out, moving the bones around, maybe a bit of cracking here and there, but don't worry. And then here we go, I'm going to show you sort of 10 minutes on this foot, and then you want to replay the video and do it on the other foot. Now, a lot of reflexologists treat the whole foot. It's a holistic therapy, and generally a lot of the time we treat the whole foot, but there's a doctor in Spain who I trained with, and he has a very different approach, and I think this one is suitable for people who try reflexology for the first time, because there's only a couple of areas for you to worry about. So I'm using a nice firm pressure. You don't want it to be too painful, but you really want to get in quite deeply. Now, if someone does have a urinary infection, then these areas are all going to be pretty sensitive, but they are key to helping the body battle this, so you really want to work them, but obviously within the pain threshold of your client. So it's sort of a press and slide. I can feel a few little bits, differences in texture under the skin here, and you're just trying to iron them out. Now, of course, this isn't instead of any traditional medical treatment. This is hopefully, if you catch the symptoms early enough to prevent it from developing into a full-blown infection. In fact, I've used it many times on my children and on my partner, and if I get there in the nick of time, it seems to help the body to fight it off. Of course, you want to drink a lot of water, maybe take cranberry tablets as well. We found something called D-Minos to be quite helpful, although please do your own research, but that's there we go. So we're just going in deeply here. How's that? Pressure okay?
Yes.
Now, often you'll find along this tendon here that you've number of knots if someone's got an infection. It's going to be really quite uncomfortable, but it is key to work it. So it doesn't matter what you want to use here. You can use your knuckles, you can use fingers. Just be careful not to dig your nails in. Sometimes we use a pressing and holding, a pumping motion, particularly with this point here, the kidney adrenal point. Or you can use this thumb walking, but really I think if you've never done it before, the easiest sort of technique to copy is just the pressing in and sliding. And that's why I recommend the Vaseline. It really is good for that. We go nice and slow. Yeah, and don't worry if you've never done this before, and don't worry if you think you're getting it all wrong. I mean, if you just work these areas for 10 minutes nice and deeply, then it is going to have an effect. It's going to help. So if a lot of people who suffer from these conditions can tell very early on whether they're about to get an infection, and it's then you want to do the treatments, and you want to try and do the treatment maybe once a day, even twice a day. I mean, if you can nip it in the bud, then that's brilliant, and you don't have to go to the doctors. Painful? Oh dear.
Just a little bit.
Okay, or ease off a bit. Sorry. There we go. Yeah, it's a bit crunchy in there. And if we've got those pelvic ganglion reflex, go nice and deep in here. Often it's not very painful here, so it feels quite nice. And if people are finding it very uncomfortable, you can always just do some nice gentle movements somewhere else, just to give them a rest. coming up to 10 minutes there. It does feel, funny enough with this condition, because everything is just in the same area, 10 minutes can feel like quite a long time.
Is 10 minutes enough?
10 minutes, look, I mean, I think the aim of these treatments is to get people to try and do them themselves. Any longer than 10 minutes is just going to be too long for some people, so I think the key is just to do it a bit. 10 minutes is definitely, with these particular conditions, because you're only really working this part of the foot, 10 minutes I think is enough. Right, I think that's about 10 minutes. So there we go. So if you want to you can carry on, just do some warming down, or you can just get right on with the other foot. There we go. Thank you very much.